The deadline to make a deal between Northern Light and Anthem has also now passed.
Leading up to last night, though, a spokesperson for Anthem says they asked Northern Light Health for an extension, which would give them more time to hammer out a deal. But Northern Light claims Anthem only told the media about that and did not bring it up during mediation. Hospital system went on to add, quote, "We have remained available to work with Anthem to come to an agreement on a new contract that addresses the needs of our patients. And at this point, extending the current contract will simply prolong the challenges of delayed and denied care for our patients."
Northern Light and Anthem have been fighting over the reimbursement rates insurance companies pay hospitals for months, while both sides try to come to an agreement on a new contract. Without a deal or extension, patients will have to pay out of network for services or be forced to find a new doctor at a time many are not accepting new patients. One state senator, who's also a Northern Light patient and Anthem policyholder, says hospitals are facing problems across the board.
I think we're seeing a real threatening of hospitals across the state, especially in rural areas. And the cuts that are coming down the pike here from the federal government to Medicaid are going to make things a lot worse.
Northern Light has already closed Inland Hospital in Waterville and a walk-in clinic in Bangor, and we learned they'll be closing another walk-in clinic in Waterville at the end of the year. Without higher reimbursement rates from Anthem, Northern Light says they'll have to cut even more. But Anthem says if they agree to what Northern Light is asking for, they'll have to raise insurance premiums. Following this deadline, Northern Light says there's a public hearing at the State House today. That'll be at 1 o'clock this afternoon with representatives from both Anthem and Northern Light. We'll continue to follow this story and bring you updates on the air and online as we learn more.